For those of you who are waiting, thank you for being here. We are now live. We'll get started at 2 o'clock on the dot, so it's still 1:59. Hope everyone is staying safe and sane and healthy these days. Okay, it's 2 o'clock. Welcome everybody. My name is Hannah Rowe and I'm the 2020 Census Manager for the Austin Asian Complete Count Committee. Thank you all so much for joining us today on our second live stream webinar. Oh, so sorry about that. Today we'll be discussing the meaning and significance of participating in the census, especially in the midst of the COVID-19 pandemic. We are in an extraordinarily challenging time. While we must navigate this new reality that we're in, the coronavirus is disproportionately affecting the most vulnerable communities here in our city and in our country, especially communities of color. And we are witnessing a very alarming resurgence of racism against Asian American Pacific Islanders in this time. So today we have the privilege of hearing from 3 distinguished Asian American community leaders who are on the front lines of protecting the public health of our communities. But also they're addressing the social and racial inequities that are all the more exposed from this crisis that we're in. So this webinar will be around 45 minutes. We'll first have the opportunity to hear from our speakers. And during the panel, you can submit your questions live here on this page, and we'll save around 15 minutes at the end to answer your questions and have an open discussion. So before we begin, I'd like to introduce briefly the work of the Austin Asian Complete Count Committee, or the AACCC. The AACCC was formed to ensure a complete count of all Asian American Pacific Islanders in the greater Austin area in Travis and Williamson counties. We are so proud to be working in coalition with the Black African American Complete Count Committee, the Hispanic Latinx Complete Count Committee, and the LGBTQ+ Complete Count Committee. All of the Complete Count Committees are working tirelessly to ensure that each and every one of us gets counted so that all of our communities can have the resources that we need for the next 10 years. So without further ado, it's my great pleasure and privilege to introduce to you our community leaders who will be speaking with us today. So if I call your name, if you don't mind speaking for a moment just to say hello so that people can see you. Jennifer Kim.
Hello, nice to see you.
So that's Jen. Jennifer Kim is the Director of Compliance and Operations at Asian Family Support Services of Austin. She's a global public health professional with nearly 20 years experience working with refugee, underserved, and immigrant communities. Jennifer has lived and worked in West and East Africa, South Asia, and the Middle East, focusing on reproductive health and gender-based violence programs in conflict and post-crisis situations. She serves as a sexual assault advocate volunteer at SAFE, S-A-F-E, and has an academic interest in the intersections of health equity, violence, and feminism. She received her Master's of Public Health and Master's of International Affairs from Columbia University. Jennifer, thank you so much again for being with us today.
It's my pleasure, thank you.
So next up, we have Emlyn Lee. Emlyn, can you wave and say hello to our viewers?
Hi, good afternoon.
So that's Emlyn. Emlyn Lee founded Brave Communities to unite students, businesses, nonprofits, and community groups to build relationships, awareness, voices, and engagement. So that's the acronym for BRAVE, B-R-A-V-E. That's again, build relationships, awareness, voices, and engagement. Brave was founded by Emlyn in 2016. So she organizes and facilitates community conversations with a focus on social and racial equity, Brave Fest, and youth leadership and social change programs partnering with the US Department of State. As a result of the 9/11 attacks, she founded an experiential travel company called Cultural Embrace. Cultural Embrace provided opportunities for individuals and groups to volunteer, intern, teach, and work abroad. A decade later, it was acquired by a US study abroad program provider, which she then served as the VP of Outreach for 3.5 years and developed their experiential programs. Emlyn, thank you again for being with us.
Thank you.
And last but certainly not least, we have Ed Wu. Ed, can you wave and say hello to our viewers?
Hello, everybody.
Thank you, Ed, for being here with us. So Ed Wu is the founder and CEO of Premier Education Partners, an education agency focusing on developing Chinese overseas students to be the next generation leaders. Prior to that, Ed worked at various positions at Dell and P&G. He received his Master of Business Administration from the University of Michigan and his BA from Peking University in China. Ed currently serves as a board of director at Austin Chinese American Network, ACAN. ACAN is also a partner organization of the AACCC, and Ed is also the president of the Huangang High School Overseas Alumni Association. Thank you, Ed, for being here with us. So we'll get started with our panelist. We'll first begin with Jennifer. So Jennifer, if you could speak to us more about the role of AFSSA, or the Asian Family Support Services of Austin, as well as community public health, and the role that the census has in playing, what role does participating in the census have in this work that AFSSA is doing? So I'm gonna give the floor over to you.
Sure, great. Hi, thank you for having me. So today I thought I would kick off our session by talking about the through line between public health, the census, and the Asian community. And what I want to emphasize, what I hope the takeaway is from my talk, is that public health is politics. What we are seeing now with COVID-19 unfurling in our city, our country, our world is the result of politics. Witness Donald Trump announcing the defunding of the World Health Organization. Public health is essentially at the mercy of public dollars. The government decides where to allocate funds, and when large-scale disasters strike, it is their leadership that coordinates the response and provides critical updates to the public. Moreover, politics fundamentally shapes health because it controls the social, environmental, and economic conditions that create the landscape for diseases. Its socioeconomic status is a well-known driver for health. And it's an unassailable fact that the hardest hit by COVID-19 are the ones with the lowest status, the undocumented, the immigrant, Black and Brown communities. Another alarming trend we are seeing as a ripple effect from sheltering in place is that domestic violence is increasing. The choice to help or ignore marginalized groups is a political decision. And we now live with the ramifications of defunding critical public health programs. Leaders scramble to put ad hoc plans in place. There's no coordinated national response. We have limited PPE and a scarcity of testing. While public health is a function of the political machine, another critical takeaway is that education is also public health. We've seen the devastating impact of careless words from politicians by blaming China for COVID-19, by labeling it as the Chinese virus. It opened the floodgates of misinformation and fanned the flames of xenophobia. And it's allowed mistrust to flourish, and it's encouraged people's worst instincts. We at AFSSA are hearing anecdotally, the fears of our clients, especially the ones who present as East Asian or who identify as East Asian, of receiving racial abuse. And we're hearing reports around the state, around the country. Addressing infectious diseases and promoting public health in general depends on our ability to collaborate, which we can't do if we are willing to tolerate marginalization, racism, and the knee-jerk building of walls. So the census. This is why the census matters so very much. If you're not counted, you are ignored. Because we live in a time where we can't assume that governments care about communities as a whole. And because we live in a time where individual health concerns take precedence over community health at large, we need to show up. And the census helps form where dollars are allocated, which is essential for public health prevention and emergency response. If Asians in America aren't fully represented, then our specific needs are harder to surface and easier for politicians to dismiss. This is why it's essential for us to stand up and be counted. So in closing, what you might think is a small action, filling out your census form, telling your friends to fill out their census forms, is a radical step to create a more robust and equitable public health system that really is for everyone.
Thank you so very much, Jen. I think your remarks really hit it on the nail about this moment exposing all these inequities that have already been in place even before this all went down. So it gives us a lot to reflect on, and for sure we're the census is such a simple way to build more resilience in our community. So we're gonna turn it over to Emlyn Lee, who is going to speak about brave communities and the ways in which she has seen in her role about our community strengthening in our response to this pandemic. And again, we're gonna, if you can also come back to the topic of the census and what role the census plays in this, that would be great. Thank you.
Sure, thank you. Hi again, I'm Emlyn. Brave Communities is a volunteer-run organization, and so we essentially, as what was described earlier, BRAVE is an acronym for Building Relationships, Awareness, Voices, and Engagement. And so in Austin, we primarily create monthly community events that bring people together to talk about different social and racial justice issues. And so we typically offer once a month, what we call the Brave Communities Conversation. Last week, we have started our first virtual kind of town hall, and this was talking about the public health and COVID. And so we invited some first responders in the healthcare industry, as well as some administrators in the healthcare. And so tying that all with like the community, where our purpose is to really collaborate and to bring voices, particularly those that have typically been marginalized, to come and be able to share their experiences and have a personal narrative so that the community at large can understand and try to serve one another. And so how this all connects with COVID and what's going on right now and the census, it's so important for all of us, regardless of your citizenship, or regardless of your race, ethnicity, or age. It's really important for everyone to fill out their forms, because each form essentially brings about $1,500 a year to our communities. So something that's as small as short as it took me about 6 or 7 minutes to fill it out, and I couldn't find my little ID number. But even without the ID number, you can fill it out. And it really helps with so many resources to our community, as far as healthcare funding for Medicaid, Medicare, maternal and healthcare services, supporting some of the nonprofits that do a lot of healthcare clinics, as well as education, like food services to the at-need kids, WIC programs. So all this is very useful for our public funding, and then also for the representation on our local and state levels. So as far as, for the public health, it's really this time right now with coronavirus, it's such an instrumental example of where and how the census can help with providing services locally and statewide.
Thank you, Emlyn. Thank you so much. So last but not least, we're going to hear from Ed. Ed, if you could speak a bit about your experience with fundraising for COVID-19 relief efforts, and how you've helped to leverage our networks for these greater public goods, and also in the work that you've done in encouraging the youth to make a difference in times of crisis like the ones that we're in now. We'd love to hear more from you about that. So the floor is yours.
Okay, Let me see if I can share a couple slides I prepared for this. Can you see that? Okay. Yeah, so again, my name is Ed Wu. I came from China in 2002, and my family has called Austin as our home for the last 16 years. So today I just want to share with you 3 things the Chinese community have done since the beginning of the pandemic. The first thing is masks, right? So we raised funds and bought and donated hundreds of thousands of pieces of medical supplies, many masks to medical facilities in Austin, in California, Boston, New York, and really all around the world. Because we all know that China was hit the first. So as the Chinese, we understand how important to protect the frontline workers, right? So if we can't protect them, they cannot protect us, right? So Chinese people, I think we are very good at making relationships, making friends. So when we saw the situation in NYC kind of getting out of control, we have friends from Australia who donated $100,000, to us. And then we have a team here purchase all the supplies. And then we have friends and alumni in NYC help us to deliver the very, very important supplies to the local hospitals, right? And it's not just the 3 organizations that I'm part of. And in Austin, we talk about the Asian Pacific Islander American Public Affairs, APAPA. We talk about the Austin Chinese Community COVID-19 Fighting Alliance. We talk about Standard Range Chinese Community. We talk about Greater Austin Asian Chamber of Commerce. And we talk about temples and the churches, right? So all these people, they come together. They're literally like army of Chinese volunteers working around the clock to get these critical supplies to where need the most. Now, the second thing I want to talk about is meals, right? So food is always very, very important to the Asian culture. We understand from the very beginning that the most vulnerable group are going to be at a high risk. So, and that is the homeless population, that is children who are in poverty. So when the line outside of the food bank getting longer and longer, the Chinese community really step up. We activated. Since then, ACON led the effort. We have provided over 700 hot meals per week to homeless shelters throughout the Austin area. And these people are our brothers and our sisters and the children. So we can't just sit at home and watching them suffer without food, right? The third thing I want to talk about is youth. And when the school are shut down and our kids have to stay at home and they get bored, right? So, and we think if we allow them to sit at home and just playing video games, we are doing them a disservice, right? The Chinese word for crisis literally has 2 parts. And the first part is danger. And the second part is opportunity, right? We all see the danger right in front of us. But do we see this as an opportunity for our community, right? So we see the pandemic as an opportunity for us to do good, to make a difference. And we want our youth to be part of it, right? So we encourage them and they really surprise us. Our youth, they have organized projects to raise over $10,000 for the COVID-19 relief fund through running and through online live concert. We have a Westwood Jr. He had an idea of using 3D printer to make face shields. And now we have 15 printers, 3D printers run by the youth to make hundreds of face shields each week. So our youth are really making a difference with their initiative, their courage, and their creativity. So to summarize, I think personally in the past, our Chinese families are known to be hardworking, and we focused on the education of our children, right, next generation. But somehow we're not very, very close to the local community we are in, right? So this is definitely not true for all Chinese families, but kind of like stereotype people have. But I think this pandemic so far has revealed a different side, and I believe is the better side of our community. That is generosity, compassion, and the love in action. Strangely, I have a feeling, even now we're all sitting in our home, isolated, but personally, I have never felt that I'm so close and so connected to the community and the city I'm living in right now. So I believe to be who we are as a people group, we really need to be, and I think we will, to be united by a common cause, which is to love the community and love our city. So, and I, back to the census topic, right? So the previous speaker talked about how important to get every count. And from my perspective, I think we can get every count. If the Chinese people, we can go all the way, right, to purchase medical supplies and to provide meals, to get our youth activated. We can absolutely get every count. It's just a matter of, we all agree this is the important thing for our community to do, okay? That's it.
Thank you so much, Ed. I'm so inspired by this incredible work that that you and your community have been doing. And also really inspiring to see the youth step up in such courageous ways. I think that all of you, all of our speakers here, your leadership has just been integral in these challenging times that we're in. And the reason that we're here today to put the census in conversation with the moment that we're in right now is to think a little more, maybe even like reflect a little more deeply about what it means to actually commit to the common good, and also to prioritize the common good as mutually beneficial for all of us. And we're all stepping up to do that so that we can be visible, we can be counted, and that we matter, like we belong to this society, and we also shape the society. So I wanted to, before opening it up to questions and a more open discussion, I see some comments here. There's a lot of activity on our site, on the live stream right now. So our call to action for all of the viewers today is that one really simple but really powerful way that we can continue to build this resilience as a community is to fill out our census. And so this has long-term effects. It's only once every 10 years. And therefore, doing it today, the 10 minutes of your time, the less than 10 minutes of your time is going to have a 10-year long effect. So I'm going to share my screen with you all so that we can go to this site. And we've shared this with you in a more detailed tutorial in our last webinar, but let me share my screen here. Okay. So are we on? I think we are. So the site is my2020census.gov. That's where you go. So if you haven't yet filled out your census, come to this site here. And then once you're on this website, you can start your questionnaire. Every household should have received a direct mail from the Census Bureau with your census ID. If you don't have your ID, as Emlyn said before, it is okay. You don't need the ID. So you can either put in your ID here. If you don't have a census ID, just click here. And for instance, we put in US state. And then you just put in your address, your street name, apartment, city, and then it's going to locate where you are and then identify the right code for you. So you just, it's really simple. I'm not going to fill it out fully here, but again, the site is my2020census.gov. Okay, so I'm gonna stop sharing my screen and come back to our conversation. So let's open it up for a more open discussion. So I'm just going to be looking through the comments here. So let's begin with a question from Anna. So Anna's question for our panelists is, apart from filling out the census, how else can we make our community stronger? So all of you may have some different responses to this, but I'll let y'all take the floor on this one. So how can we make our community stronger apart from filling out the census?
I'll take this. I'll start with this. And for me, I think there's like 3 major resources that a person can have. That's time, talent, and treasure. And so there's multiple ways that you can help serve a community. That could be just, you know, what treasures obviously donating and, you know, providing funds for organizations that are doing things like Ed was saying, ACAN's receiving funds for purchasing medical supplies or for, you know, passing out foods. And then there's also the time of being able to like help deliver that. And while we are all, you know, concerned of the health and safety of our own lives and then our loved ones, you know, definitely follow the protocol of like wearing proper safety, like masks and everything. And so I think the best ways really is to like see what your gifts are and then where your passion lies too. If it, you know, if it's to young people and students, I know AISD is still having a very hard time trying to get computers and printers to all families. And Brave will actually be hosting a town hall next week on the 21st at 6 p.m. with AISD members and board members to talk about how we can share and distribute the needs and asks from our community. So there's different ways, you know, whether it's youth, whether it's medical and health, that's where you're feeling things. So I feel like, you know, while we have to kind of stay home and be sheltered, what you feel like are your best resources. I'm going to send in the chat a couple of websites. You know, I know there's a lot of great resources, whether that's local here in the city and checking out the Austin Public Health page. And I think each department has like its own COVID response to, you know, the state department, I mean, the state's level of like Governor Abbott's website to your House of Representatives. But we also have one, a community group has worked together to create a general community leaders like coming together and working on a web page. And then also Brave Communities, we don't have it on our web page, but we're trying to send out more regular newsletters so that it has a compilation of all the different organizations and resources that can then help with people during this time. So I'll send it, I'll put a couple of links on the chat board if that helps.
Thank you, Emma. And I'll share those links at the end as well with our viewers. So if you can put it in the chat box, that would be helpful. Thank you. Jen, did you want to add anything?
Yeah, so I think coming from Asian Family Support Services of Austin, so AFSSA, we focus on domestic violence and sexual abuse, and it's no secret that sheltering in place is dangerous for people, for some people. And I think violence flourishes in dark spaces. So I think another way to help your community is to raise awareness about the issue of violence, especially among marginalized and underserved communities. A lot of our clients, and you know, we provide really comprehensive services, and I know that a lot of our clients are suffering because they are the ones who are restaurant workers who've been let go or who have had, I guess, non-traditional labor. And they're really, it's hard to keep your family fed, to keep yourself safe, to shelter in place. So I think raising awareness about resources we have, such as our hotline, just knowing that AFSSA exists and telling your friends that, here's a resource if you know someone who's in crisis. That's just from, that's just one angle of this entire problem.
Thank you, Jen. If you don't mind sharing that hotline number in the chat box, I will share it with everyone at the end. Ed, if you wanted to add anything, this space is open for you.
Yes. Yeah. So the question, I guess, is how do we serve our community, make our community stronger?
Yeah. Including, but not beyond the census as well. Yeah.
Of course. Yes. So there's just a couple of personal thoughts I have here. I think the first thought I have is we all can be an advocate. We all can be a change agent. It doesn't matter, what's your social status. Doesn't matter if you're, community leader or is just a normal, family member, right? So we all can do something, can influence the community we are living in right now. So that's the first thing, we just need to believe that. And the second thing I think is very, very important is we need to put into action. We need to do something. We don't just talk, right? So there's a lot of Chinese live in WeChat, and there's like huge debate in terms of, what is right and wrong and where the virus came from. And we can spend all this time to talk and debate. And at the end of the day, we have to let the scientists to figure that out. And we can wait, right? But in the time of waiting, we can do something to help each other and to help the community, right? So that's the second thought I have. The third thing I think, thought I want to share is we can all leverage the connection we already have. We all very powerful connectors, and we have the potential, we have the resources, we have friends, right? So we're all part of a class, we're part of a school, we're part of something. So we can leverage the resource and connection we have to do something together, and that's very powerful. And the last but not least, join a group. Don't just be yourself. There are so many groups out there now in Austin for Asian Americans, right? So like ACON and the APAPA and all this, small, large groups. Join the group, find the cause you like to support, and we can do this together.
Thank you so much, Ed, and thank you, Emlyn and Jen, for your thoughts answering that question. Yeah, you're all right. We're agents here. We can be agents of change no matter who we are. And we each of us individually we have actually a lot more power than we may know in bringing that change to our society and to our community. So I'm going to move on to the next questions. They're more specific to the census, it seems. So Anna had another question. How long does it take for the census data results to then come back and improve our communities? So my understanding, and I'm happy to answer this question. Feel free to chime in, speakers, if you'd like. But my understanding is that the census data will be sent to the White House at the end of the year. That may be a little bit delayed at the end of 2020. So that may be a little bit delayed because census operations are beginning to be delayed because of the coronavirus, because census takers may not be able to do field operations because that is not at this time safe. But as early as next year, 2021, that's when we get to see the distribution of these funds into our community. So this is really soon. This is we're going to be feeling the effects of the census data as early as 2021. So if you think about it, if we're losing at least $1,500 per person per year, that's if for a person that's undercounted, we're losing at least $15,000 from every person that's undercounted in the census. So like Jen said earlier, if we're not counted, we're ignored. It's as if we, legally speaking, don't exist. And we don't want that to happen. Everybody counts, and we want all those resources that we need to come back to our communities. That's what we expect when we pay our tax dollars for those dollars to come back into our community. So that's my response to that question. Okay, so Alex Pong has a question about whether or not the census is mandatory. It is mandatory. It is required by the Constitution of the United States. Okay. And let's see, we have another question. Give me a second here. It's a lot of questions to sift through. So there's a question from Alex about Obamacare. And maybe I think I'm going to actually give this over. Maybe Jen, you could also help respond to this as well from your public health perspective. I think the question, so he's remembering when we've had to show medical coverage, and I think that's still the case, that we have to show that we have medical coverage, or we have to pay a fine if we don't have coverage. So I'm not sure exactly what the question is from that, but I wonder if he's asking about the distribution of how the census data actually is related to Obamacare or public health funds. So if we can expand a little bit more on that, that would be helpful. Does that make sense?
I'm just rolling that around in my brain for a minute. How the census, so leaving aside Obamacare, what I understand is census data gives us an idea of our demographics. Demographics influence the type of health programming each state does. And, at a federal level also, but like, I'm just talking like each state, each city, we have like municipal health departments and all rolling up to the state. It's hard to allocate funds if you don't know what the state of the state looks like. Like if your state is primarily older, then you can just based on like health modeling, you know that there are likely to be more chronic diseases in that population. So as a health department, you start putting aside dollars for those types of programs that address it. I know, and again, I know I'm not fully answering the question, but that's because I'm not well-versed in health policy as per se, especially as relates to the Affordable Care Act. But gee, now's the time that would be great to have health coverage for all, wouldn't it?
Right. I mean, that definitely, thank you, Jen, first of all, for your answer. I think it just goes to show the ways that becoming visible through the census allows the federal government to understand how to distribute funds, especially when it comes to resources in public health and healthcare. and that it just goes to show how important these public resources are. And healthcare is such a, it is the topic of discussion right now. And it's interesting that we're in a moment where that is even more amplified, and we have to be talking about what it means for all of us to have coverage. You know, there's so many individuals and families who may even be afraid or not know how to even get a test because they may not have health coverage. So I think that it just goes to show how important participation in the census is, but also how important these public health resources are. So I hope that answered Alex's question. So let's go to one last question here. I think this is a good one to close on, actually. So how can we as everyday people help and ensure that we all complete the census? What a great question. I'm happy to answer at the end, but do y'all have any input on this? Like, how can we as everyday people, you know, help others and to fill out the census? What can we do?
While we think about that, can I actually piggyback with some of the comments that you just made, Hannah, about the uninsured and undocumented? I've learned this from our last Brave Communities conversation, and from some of the panelists that that serve in emergency health clinics as well as central health. So, and again, this kind of ties in with the census, because this is helping these nonprofits and organizations that are serving the underserved and low-income families. That there are clinics that are serving uninsured and undocumented. So, you know, whether you're an audience right now or you know people that need any type of health services, I'll post again the link to some of these places on the chat board. But I know Community Cares Clinic, they have closed a bit more clinics recently, more so for the protection of their staff and then also the lack of PPE gear. But they're also trying to move to have more telehealth calls, so people can call on the telephone. But just not to deter people that if you're not if you don't have insurance or things, like there are still services that are available. So I know one is Community Health Clinic through Central Health. And then I also know that there is talk about having some pop-up clinics, and we can, share that information if and when that, comes about, especially in the Eastern Crescent of where it's lower income. And then I also know, we think about health as like medical, but obviously food is such an important part, and the food deserts in our community. So obviously, like the food, there's a lot of organizations doing things and packing and distributing, and including Ed and his groups. But I also wanted to let people know that 211 for the United Way, that's a national number that people can call. And then here in the Central Texas Food Bank, they are working with like different churches and packing foods and then distributing that. I know the lines has been quite long, but at least there's a link that can be shared for how to get where the different pickups are. So I'll include that in the link. But to go back to your question, as far as how do we encourage or how do we know? I mean, if everyone's home and just like talking, and I feel like Zoom's getting more popular, or texting and phone calling because you're not seeing people, it could be a way to just like bring it up in conversation, and I think especially what's going on right now, and we're all going to need to work together to provide, whether you're a small business owner to a parent to, regardless of what your class or race is, it's really going to be important to know how not only are we receiving the funding and for our communities, but then who is going to be the voice representing us. And so I think that's, and plus it's also potentially an election year. I don't know if it's going to change, but the election later in this year, I feel like it's a test to see how we are actively being an engaged citizen. And so if we can, talk to our family members, talk to our neighbors, you know, and that doesn't have to be physically, but even just on a text or Zoom call or a Facebook message, and just like say, hey, you know, like I just filled out my census, like, how about you, you know, and then just let them know the importance of it. I think the word of mouth and kind of, you know, you being the influencer to your network is the best way.
I totally echo that. Thank you, Emlyn. So another interesting and fun tool that you can use for reaching out to your friends and family is actually to follow us at the Austin Asian Complete Count Committee on this app called Blue Squad. So you can download this app on your phone. Look for us. You just type in Austin Asian Complete Count Committee and then support at the AACCC, and then from there, there are sets of missions you can complete. But basically, it's just an easy way to text your contacts on your phone, and you can also control, you know, whom to contact as well. And it's a great way to get the word out about the census, and it's a great way to harness your leverage the networks that you already have. So it is now 2:45, so we're going to come to a close. Thank you all again so much, our panelists, for joining us on this really important conversation. And to our viewers, thank you for joining us today. We'll be having a live stream like this one every 2 weeks, and as well as multilingual tutorials and webinars. So please visit our website at aaccc-atx.org for more language resources. And if you have any questions or ideas, especially after watching this webinar, please reach out to us at aaccc.atx@gmail.com. So before we go, I do want to share the resources that our speakers have shared with us. So with the Community Resilience Trust that Emlyn also spoke about, where the community is gathering to share the resources that are available. The website you can go to for that is coronavirusaustin.wordpress.com. And you can also visit the Brave Communities website at www.bravecommunities.org. Subscribe to their newsletter, and they will be sending information and resources to the community during COVID-19. And the next Brave Communities Conversation event is on April 21st at 6 o'clock with AISD. So thank you, Emlyn, for sharing that information. And the hotline from AFSSA, or the Austin Family Support Services of Austin, the hotline is 1-877-281-8371. You can also visit their website at afssahaustin.org. Okay, I think that about covers it. Thank you all again so much, and be safe and fill out your census, and also tell your friends and family to do so. So thank you all again, and we'll see you next time.
Thank you. Bye.
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 Thank you.